Hi, this is Dr. Guha Thakurta from A Medical Center. Let me discuss a problem that all of us face at some point or the other, and that's a red eye. The commonest cause of a red eye is allergic conjunctivitis and an infective conjunctivitis. With allergic conjunctivitis, what we get is a mildly pink eye which feels very scratchy and itchy, and it feels as if there are grains of sand in the eye. There are a number of anti-allergic drops that we use, and at times we use a low-dose steroid drops. Now, this should be able to control the whole situation. However, I would sound a note of warning that please do not use steroids on your own. Use it only under medical supervision, because there are long-term problems with using steroids, like the eye pressures may go up, and you can also develop cataracts, or if there's an infection, it could worsen it. The second reason for red eyes is an infection, and mostly it's a viral infection, and so antibiotics have no role to play in it. However, we do use an antibiotic to prevent a secondary infection. The red eye in an infective conjunctivitis involves quite a bit of a red eye, along with a lot of discharge, and that differentiates a conjunctivitis due to an infection from an allergic conjunctivitis. Here again, I would suggest something. Sometimes we go to the pharmacy and ask for whatever drop is available for a red eye, and invariably the pharmacy will give moxifloxacin, which is actually a reserved drug for us to be used in serious infections and cataract surgery. Unfortunately, because of this rampant use, we will soon become resistant to these drops, and that will be a very unhappy situation. Besides these two, which are common, there are certain things which are uncommon, like anterior uveitis or iritis, which is associated with people with autoimmune disorders like arthritis or inflammatory bowel diseases or various other kinds of autoimmune disorders. With this, you get a red eye along with severe photophobia. The light really hurts, and this is something that needs to be seen immediately, because early treatment prevents any damage to the eye. The other, quite a rare condition for red eyes is an acute increase of intraocular pressure, which we call acute glaucoma. In that, there is a lot of pain along with blurring of vision. If that happens, you do need to see an ophthalmologist as soon as possible, because it can cause damage to the optic nerve. Besides all this, there are commoner causes like contact lens overwear, or an injury to the eye, or sometimes you get a little bleed in the eye, which we call a subconjunctival hemorrhage. Now, these are pretty obvious, and these are not, the patient himself or herself will realize why that has happened, so they will automatically come to the doctor. Now, this little talk that I made is basically to point out the various causes of red eyes and when you should see a doctor, either in a few days or immediately. I hope you don't need us, but if you do, we are all available at AM Medical Center, and thank you for watching.